At the time of my diagnosis, actually I was a new bride. I had just been married, and my new husband and I were actually enjoying life with our grown children and our friends and family. So this was quite a hit out of the sky.
Chemotherapy works by killing cells that are actively dividing, by attacking the DNA or various steps in DNA duplication. Cells that are actively dividing tend to get hit, and those that are not dividing tend to be spared. So the side effects of chemotherapy, as well as hitting cancer cells, can also affect cells of the body that divide quickly. So neutrophils are a type of white blood cell whose job it is really to fight bacterial infections. If they are low, it's called neutropenia, and patients develop a fever or infection that can be a very dangerous, life-threatening complication of chemotherapy. If a patient develops febrile neutropenia, after they've recovered, subsequent cycles of chemotherapy often require some changes to the protocol, and those changes can include lowering the chemo dose or sometimes postponing chemotherapy to allow for full neutrophil recovery.
I realized that a low white blood cell count could be a part of something that I could experience as a side effect from chemotherapy treatment, and I knew that it could definitely be problematic, so I was very alert and aware. I was very fortunate in that there were no delays at all within my chemo treatment. As soon as my body started to respond to medication and I started feeling better and the symptoms were less, I was able to resume the same routine that we needed to go on, and I didn't miss or delay any chemo treatment, so I was very, very fortunate with that. It is really important for patients to know exactly what could happen. You need to know everything about that.
So chemo patients receive comprehensive education about their chemotherapy and common side effects when they start their treatment journey. However, patients tend to focus normally on the common effects of tiredness, hair loss, nausea, and we take great pains to emphasize the importance of neutropenia. It is really the most dangerous side effect of chemotherapy. I recommend patients discuss with their oncologist, what their common side effects should be with that particular chemo regimen and what can be done to minimize them. But also to look especially at the issue of neutropenia and febrile neutropenia and what they can do to minimize that risk. The bottom line is we want patients to be focused and their treatment to be focused on fighting their cancer, and we don't want to worry about the side effects.